Well, good morning, good afternoon, or good evening, whenever you're listening to this little segment. My name is Dr. Deepu George, and I work as a assistant professor of family medicine in the Department of Family Medicine, and I also serve as the director of integrated behavioral health for UT Health Rio Grande Valley. Today, we're going to focus on importance of mental health, particularly with the focus on thinking about some topics and perspectives for men and how men can better take care of their mental, emotional, and behavioral health. So one of the things I was thinking about this question is just to frame it in a larger context of just looking at health in general for men and women. And part of the struggles in terms of maintaining emotional health and behavioral health or mental health for men may be a sense of rigidity and inflexibility that people experience around like certain expectations that society has on men, right? So I have a poem that I pulled out, and it really begins to contrast the vulnerabilities that may exist in the gender norms and stereotypes that men are often expected to live up to, right? So I'll give you a few sentences here, and then I'm sure we can also have it available for you in the video below the link. So a couple of things that it really made me think about was like, for example, Nancy Smith writes, "For every woman who is tired of acting weak when she knows she is strong, there is a man who is tired of appearing strong when he feels vulnerable." Some of the behaviors that are helpful in maintaining good, positive emotional hygiene and mental health requires a self-care, nurturing, and attending. And sometimes those are not what men are often rewarded for, right? Men are sort of rewarded to be tough and very stern. And so then they may be two broad stereotypes, but those are the expectations that we often pass down. So looking from that angle, there are certain things like anger, hostility, or irritability in men are sort of like normalized, but they may also be signs of emotional struggles or mental health struggles that they have. Intimacy issues may be difficult for men to bring up, but that may be something that's common. And then I always think about adverse childhood experiences. These are experiences that you've had when you were a child that included some amount of exposure to really bad and negative experiences like trauma, any sense of abuse, family separation, violence, etc. Those impact men and women in different ways, but they definitely have an impact. So not really thinking about how early experiences have impacted you now. That may be a missing link in thinking about men's health as well, men's mental health. So those are common mental health topics that I think men may find it hard to talk about or openly be vulnerable about. So one of the big things that we try to do is to just begin to think about your mental health just like your physical health, right? And so many clinics now often do annual screenings for depression. Some may even do annual screenings for anxiety, which is a good step because we may be identifying missed opportunities to intervene or even just talk about things, right? So one is just to look at your physical health, all the things that you do for your physical health. It's the same things that you want to do for your mental health. So we tend to see it as very different. We don't really talk about it, and hopefully healthcare is changing where we are beginning to think about a lot of those factors as more similar. And then there are clusters of experiences that we bring together and symptoms that can be addressed through psychological behavioral changes and new skills, right? So when you seek help, there may be a tendency to think, well, the only help that I can get is through medication. Well, a lot of the times, along with medication or even without medications, there are psychological and behavioral skills that we can teach that'll actually help you respond better to the symptoms that you're experiencing so that you can function more actively in all the roles that you have. Yeah, I would just sort of say, what can you do to keep yourself healthy, right? Like, what are the concepts and ideas that you want to do to keep yourself healthy? Well, big component in every health conversation should be the role of exercise and regular activity, right? So the more active you are, the better your health physically and mentally is going to be, right? So it's just going to be a protective factor. It doesn't mean your problems are going to go away. It just means that you will be more ready and equipped to deal with these issues. The other part of that is just making sure that you do take time to do things that you enjoy, and those could be any activities, right? So I think in the Valley, I've heard a lot of people talk about going fishing, going hunting, spending time with their family, even barbecuing out and grilling out, or whatever the activity may be. But it's important to schedule in. It's almost like, can you dose yourself with positive social interactions and relaxing activities, regardless of what's going on around you? Because those are the moments that's going to help you bounce back. I think about two particular videos that we can link as well into the link below on YouTube. One is this TED Talk by Brené Brown that really talks about this thing called the power of vulnerability, which is a way to think about how can you be honest and courageous with emotions and parts of your life that are difficult to acknowledge or accept. The second one is just this whole thing of, how do you maintain emotional hygiene? Like, how do you maintain clarity of thought? How do you maintain clarity of behavior as you go through different stressors? And that's another TED Talk by a guy, Winch, and we'll attach both of these links to the video so that you may have access to it. So do your exercise, make sure you connect with people, do other things that you would normally do, don't overeat, excessive drinking, drug use, etc. Refrain from all of those. Those are good preventive measures. But on top of that, just to begin to think about your own mental and psychological health, these two videos would be really helpful in helping you think about your prevention efforts that you can do. Thank you for tuning in, and thank you for listening. Hopefully these suggestions are helpful to you, and the links that we've provided are going to help you translate some of the things that I said into regular habits in your life. Thank you so much.